Okay, look like we're at top of the hour. Let's go ahead and get started here. Everyone at Center is aware this is our cybersecurity month. All right, so to celebrate that, we got a couple different events this month. One thing that we have that is hugely we're appreciative of, Mr. Yarborough, who is on. He's part of or leads. He's the CISO for Health and Human Services for the USA. And we appreciate your time, Mr. Yarborough, for coming on, and we know your time's valuable. And we're going to consider this more of a fireside chat. Really, we have some standard questions that we'll go through. At the end, we'll have time for Q&A. For folks that need to post questions or you have questions as we go through some of the agenda items, please feel free to add them to chat. Taylor will take those and we'll answer those at the end. So thanks to everyone at Center. Thanks to Chris Pace, who is our CEO. Thanks to Mr. Yarborough, as well as Craig Cheatham, who leads CIO for our organization. I do want to first start off to make sure we give honor to Mr. Yarborough here, and want to read his bio, if you don't mind. I'll just take a minute here. Mr. Lamont Yarborough is the Chief Information Security Officer for the Department of Health and Human Services for the USA. Lamonte joined Health and Human Service Office of the Inspector General in January of 2020 as the CISO, where he immediately instituted changes, to fortify security outcomes. He worked for the Department of Homeland Security, held several leadership and cybersecurity positions, including serving as the CISO for the DHS headquarters, IT organization, and the federal FEMA, we commonly known as FEMA, is the Federal Emergency Management Agency. He stood up DHS headquarters, Information Security Organization, which is a huge undertaking from the ground up. Before his work at DHS, Monte was a contractor providing cybersecurity services to DHS headquarters and served over 20 years in the U.S. Army. Thanks for your service, Mr. Yarborough.
Thank you.
Specialize in information technology and cybersecurity. He has a bachelor's degree in liberal arts from Exeter College, a master of science in cybersecurity from Webster University, a master of science information assurance from Strayer University, and a master's certificate in IT project management from George Washington University. He's also a certified information security professional and alumnus of the Federal Executive Institute Leadership for Democratic Society program. So that's the bio. Mr. Yarborough, anything you want to add before we get started?
Enough said.
All right, all right, sounds good. So, Mr. Yarborough, we're a small team in Texas. We are a very talented team in Texas. We take cybersecurity very seriously as pretty much security first approach. We have our CTO, Todd Smith. We have myself, who's the CISO. We have Craig Cheatham, who's the CIO. We have Pace, Chris Pace, who's our CEO. And then we have Shelly. She's our CFO. We all take controls and cybersecurity very seriously, right? So we want to take this time and really we work with CISA, with Jan Easterly out there, as well as being part of InfraGuard here within the USA to combat crime, combat cyber crime, and make sure we're prepared and protect our organization as well as customers. So I'm going to start off real quick with the first question we had, and feel free to elaborate. Mr. Yarborough, is the Health and Human Services approach to cybersecurity. What is the approach and why is it so important to Health and Human Services?
Appreciate the question. Well, let me first start by saying that notwithstanding what occurs here within HHS, I think data protection is critical to, the HHS mission and perhaps anyone's mission, right? There's a lot of sensitive data that resides on our systems that are, again, mission critical, that we depend upon the need to effect our missions, as well as, sensitive data that, everyday Americans, some of their sensitive data resides on our systems and or, our partners. So, effective security measures help safeguard data from unauthorized accesses, breaches, or misuse to protect, the privacy and confidentiality and integrity of that data, right? So included in data protection, at least as far as I'm concerned, at its base is the continuing practice of cyber hygiene and educating our employees and other stakeholders on, best practices to be proactive and continuously aware, continuous awareness rather, to be, cyber safe or sensitive to the notion that we're dealing with, perhaps sensitive data that in the wrong hands could pose some type of harm to whether to our mission or maybe, private individuals.
Right, right, absolutely. We often we deal with data day in day out, whether it's finance, whether it's whether it's confidential data, privileged data, regulated data, GDPR. It's one of those items that I don't know if from a chat perspective, I don't know if folks understand the value sometimes and the protection mechanisms that's required for that data to be safeguarded, right? So that's a huge key, and we appreciate the input on that one. That from a data perspective, like a data loss and data protection, is that something that's a focus at the Health and Human Services organization or
Uh,
entity? Oh,
Absolutely. There
okay,
are a number of compulsory requirements that pertain to how HHS or any other federal entity, and to a large degree, even private entities, behave with respect to, their approaches to protecting, sensitive data. So,
okay,
absolutely.
okay, gotcha. All right, good deal. So HIPAA regulations, right? When years ago when I started off, I don't want to age myself here, but years ago I started off in IT on the infrastructure side way back in 1992, right? That seems like it was yesterday. But starting off on infrastructure, there wasn't a huge focus on cyber or data protection, right? As 90s evolved into the early 2000s, there started to be a focus, right, on data protection and the evolution of the dot-com period and making sure that we can involve the use of technology in our everyday lives. I almost call it digital citizens, right? When you think about it, some way somehow we're all digitized, right? We're becoming a connected world, right? Well beyond the US borders, globally we're becoming connected. So I'm curious on the HIPAA regulations over the years. We track things internally here at centers such as the OCR, the enforcements of HIPAA, the fines, and some of the technical safeguards, which are some of the protective controls, right? We're trying to move away from, hey, I detect this, right, rather than I can prevent these things from happening. So for HIPAA, can you kind of explain the tech, how did it evolve over the years, the technical safeguards and the requirements to protect that data?
Sure. So I'll do my best. I don't know that, I guess you'll appreciate my answer after I give it, I guess, because I can appreciate the interrelationship when you talk about HIPAA and cybersecurity, right? But there is
Hmm.
some degree of nuance. So within Health and Human Services, I run an office called the Office of Information Security, at least at the headquarters or the office of the secretary level, right? I have this large team of hundreds of employees comprised of federal employees and contract employees, et cetera. So the Office of Information Security's charge is to protect data and systems, and not necessarily in the regulation of protecting PII. So let's focus for a second on the applicability angle or the relational angle between HIPAA and cybersecurity, right? So HIPAA regulations apply specifically to what is called covered entities in the healthcare industry, at least from my premise, being part of HHS, as well as their business associates who handle protected health information, right? So with that, it outlines specific requirements for these entities to protect the privacy and security of public health information, including administrative, physical, and technical safeguards.
Hmm.
Cybersecurity, on the other hand, applies to various sectors and industries beyond healthcare in particular. So it involves protecting any digital system, network, IP enabled, systems, et cetera, and data from
Hmm.
cyber threats, and requires implementing controls, tools, and practices to mitigate or ameliorate those risks in different environments,
Right,
right?
right, right. Awesome. I think that's an awesome thing, and I think one of the challenges, at least from a cybersecurity perspective, right? There's always IT productivity, right? IT, when you think about it, is more or less a productivity tool, right? It makes things more efficient, right? You could do things that typically took hours years ago. You can do them in minutes, right? How do you? Is there a specific approach that you take, to balance the productivity angle and also wrap around the cybersecurity protection of that technology, if that makes sense? Uh,
It does, and
okay,
again, I'll state, as a federal entity, we're bound by, a number of compulsory measures, law and practice, et cetera, with
right,
respect to our risk management framework that, relative to, NIST uh, 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 guidances. We're bound by the Federal Information Security Management Act,
okay,
and several other things that kind of inform how we behave with respect to the instantiation of our systems and how we
right,
protect them, right? So
okay,
but at the same time, we're a mission-driven organization, and we're quite a large and federated organization as well, right? We're
right,
comprised of some 90,000 federal employees and,
right,
just as many or more of contract employees that support us in, our everyday, mission sets. So me sitting at the enterprise level of the agency, and I am concerned about the behavior from an enterprise perspective, but
right,
at the same time, being the federated, being that we are highly federated, there
right.
are, chief information officers and chief information security officers that, some of the quote unquote lower levels, if you will, you might think when, a lot of everyday Americans, when they hear the United States Department of Health and Human Services, doesn't really resonate with them because perhaps we're not a household name, but some of the elements that comprise HHS are. For
Right.
instance, you may or may not be aware that the Center for Disease Control is an element within HHS, or the Food and Drug Administration is an element within HHS, or the National Institute of Health is an element of HHS, or even the Centers for Medicare and Medicaid
Right.
Services are, an element within the United States Department of Health and Human Services. So each of those, and we call them operating divisions, and there are more. Each of those have their own chief information officer and their own chief information security officer who kind of look over their system portfolios and make some discernment on how those systems are protected, right?
Awesome, awesome. Yeah, the rise of, I didn't hear the term years ago. Just started over maybe the last 5 years. The rise of the BISO, right? Business information security officers, right? Over the lines of business. So that's an interesting approach. That's good stuff. Thank you for the response there. I do have a question for you, and this is a tough one, right? Because the way I look at it, AI has been around forever. Algorithms has been around. We consistently use it. The media got hold of the whole Chat GPT, and they got hold of Bard and Open AI and just other solutions out there, right? I'm curious, because as soon as the media hits, notice folks start using, Chat GPT, right, within the org, and yeah, they're like, wait a sec, let's hit the brakes on this. Let's make sure it's safe to use, right? How, and that's the advancements of technologies. But how do you, or at least how does HHS handle that new technology, or that new open AI or Chat GPT? Is there a unique approach that you take there?
Uh, okay.
Right,
Okay, let
right,
me
right,
start.
right.
Okay,
Two,
so
2 a.m. in the morning, I'm working up, turning around, like,
yeah, I
wait,
need, I
who's
need,
using
I
what?
need, I need more coffee. Wow. Okay. No, no worries. I appreciate the question.
Right,
So,
right, right.
so so HHS is focused on,
Mhm.
again, the systems we need that important infrastructure to, advance our strategies and protecting malicious threats from, all of our digital assets, right? So
Right,
as we encourage the responsible development and adoption of AI technologies in the healthcare and public health sector, to ensure, patient safety and
right,
privacy. We are collaborating with other federal agencies under HHS and externally to kind of help. And I should back up and say, the prevalence of AI and how we use it effectively and safely is not necessarily a struggle, but an undertaking that the whole of government, not perhaps industry, is addressing. Right. So,
Right.
we're collaborating with federal agencies and others within HHS and again elsewhere to develop guidelines and guardrails, standards, etc., to secure
Uh-huh.
data protection for the effective implementation of said AI tools, right? So
Right.
it's
Right.
important to note that our posture on AI is continuously and evolving. And as this technology advances with new government policies, there are work groups that come together within the federal space, and I would
Right.
imagine elsewhere, to kind of discern the right approach, right?
Okay.
From my perspective, and irrespective of how you leverage this technology at its base, um, I think a large part is going to be user education, right?
Okay. Okay.
The folks that leverage it and the impacts and discernment of how they leverage it, what type of data they feed
Right.
into it, and what the potential impact of feeding that data into this tool would mean. So I
Right.
say that to say you can put in some guardrails, you can put in some logical or technical controls to, to kind of, enforce how some of this is used.
Okay.
But I think what would be most key is some user understanding and or training to express the importance of or the mind a state of mindfulness and awareness of how you leverage this technology
Absolutely.
every time you use this technology. To use
Absolutely.
this passively might introduce some risks that you haven't considered. That's why
Right.
I think it's incumbent on everyone who uses this to understand what the potential impact, good and bad, would mean from the use of AI technologies.
Absolutely. Absolutely. I love the technology. I think it's going to advance. They talk about the new cloud front, 4.0 reboot of technology, but I think the technology is great, right? It just as you mentioned, those guardrails are important to have. I got you. So I'll flip the kind of next question over to you kind of hinted at it in the response there to ChatGPT and OpenAI and Bard and other solutions out there. What about the you know security awareness, right? We take it very seriously at Center and we make sure even working with customers we understand the importance of it. My take on security awareness is that if it doesn't exist, any control could be bypassed by humans, right? You trick the right human and it just turns into a disaster, right? And human firewall, commonly it's called the human firewall. I remember back in the this was years ago. I was engaged in work with BP, and after the Gulf incident with the rig out there, and there was an incident. Um, now every meeting, right? The CEO came out and said every meeting we're going to have a safety moment right before every meeting. 3 minutes. It can be very short, just 3 minutes safety moment. Then you start in the agenda. What's your take on security awareness, right? With HHS, how important is it, to HH, Health and Human Services, and how it's important in the everyday culture, within HHS.
Yeah. Again, notwithstanding, me actually sitting here at HHS is important, period. Right.
Hmm.
No matter where you are and where you do. This is my fourth turn as a CISO. Been at this a long time, and
Okay.
I've always said that irrespective of how talented your technical, operators are, cybersecurity operators are, irrespective of how updated your cybersecurity tools are,
Right.
the weakest link will always be your user constituency, right? So if
Absolutely.
they're not aware, if they're not in the habit of being mindful of their behavior when they interact with data and systems, none of that is meaningful. So yes,
Absolutely.
we're in
Absolutely.
October, and as you know, or as perhaps all of you know, October is Cybersecurity Awareness Month. So with respect to HHS, in collaboration with CISA, we've launched a uh, social media campaign that includes cyber messages as part
Right.
of an awareness campaign, and it's primarily targeted toward the healthcare and public health sector because that's where, that's where most of our mission, who we serve. And we're trying to influence key behaviors to be cyber safe. So with our federal agencies, the HHS cybersecurity program, along with our Assistant Secretary for Administration, we recently launched a month-long awareness, educational, and training program for
Awesome.
HHS employees to secure digital assets and, work at home. So
Yeah.
our cybersecurity awareness training is a timeless and I think crucial endeavor required for all individuals, from kids to their parents, to
Right.
the elderly, and to the disabled, and of course, all of our employees and stakeholders, not only to prevent cyber attacks, but more importantly, to teach individuals how to protect their sensitive and personal information. So when we're equipped with the best cyber practices, specifically at the user level, and what cybersecurity awareness training provides to be safe, it strengthens the overall security posture of
Absolutely.
HHS, our
Absolutely.
federated agencies, and of course the American public.
Absolutely. And I think spot on, right? I don't want to add to that because it was a great segue and comment on security awareness. I think the human is the key, right? At the end of the day, we're trying to protect humans, right? Human life and data, and it's spot on that one. Thank you, Mr. Yarborough. The next question I do have, when I started way back, 1992, right? Maybe before some folks were even born, right?
I
Back in
laugh at that because, of course, I predate you, right? So when you say that, it makes me feel even older, right? But do
right,
go on.
right. Back in that time, there wasn't a lot of you see CISA now, you see Health and Human Services, you see FBI, you see the NSA, right? They're all trying to get information out on security and how to secure and protect the commerce of the United States. What's the I mean, what changed from 1992 to 2023 that now you see these agencies engage with these public and private partnerships? What's changed, or what's the good, the pros of that? Right.
There are a lot, but top of mind reaction is to say, quite frankly, we need each other, right? We can learn from each other. We can offer perspectives and contexts from where we sit to kind of inform, how we behave and how we better protect ourselves collectively, right? So you talk about CISA, and perhaps I'm preaching to the choir, and maybe most of you do, or maybe you don't know the instantiation of CISA and their responsibilities as it pertains to federal agencies and America writ large is, from a risk management perspective of what we call critical infrastructures.
Right.
So there are 16 critical infrastructures that are leveraged by everyday Americans, even if you're not aware of what they are or not. There are 16 critical infrastructures that everyday Americans rely upon to live their lives. One of which, is perhaps communications. What if you woke up today and you tried to turn on your phone and it didn't work? Or you tried to use the broadband in your phone in your home and it didn't work and it was gone, and it wasn't just an intermittent, it wasn't just intermittently unavailable, but say it was unavailable for days, weeks, months.
Right.
How would that impact your life? What if you woke up today and you turned on your water faucet and you could get no water, and you're thinking, well, is this relegated perhaps to your home, to your apartment, to your co-op, etc.? But what if it was widespread? What if it was no one in your town could access water, no one in your state could access water, or better yet, nowhere in the United States could you find clean water?
Right.
That's another critical infrastructure.
Right.
So
Right. Right.
the Department of Health and Human Services, we are what's so CISA has the overall federal responsibility to protect all these 16 critical infrastructures. But
Hmm.
there's another, but as good as they are, there are other folks as it pertains to specific critical infrastructures who are more who spend more of their time in that space, so can perhaps better understand it and can help inform how to better protect it. So when you refer to HHS, one of those critical infrastructures is called the health and public health care sector. So HHS, we're
Right.
in the
Yeah.
business of serving this particular sector. So what CISA does is designate HHS as a sector risk management agency and delegate the responsibility, or primarily, or at least in partnership with them to some degree,
Right. Right.
as the
Yeah.
proponent of serving and protecting the health and public healthcare sector. So
Okay.
the value of public and private partnerships as it regards cybersecurity defense, specifically as it applies to the health and public health care, the healthcare and public health sector,
Right.
it can establish collaborative efforts as opposed to kind of force feeding, because nobody's responsive when you're being told what to do. Your ability to
Right.
participate in mutual outcomes that better protect our sector, I think people walk away with a better sense of ownership of what it is we're trying to accomplish. So, with that
Absolutely.
shared expertise and resources in building resiliency against cyber attacks, and that partnership can fuel rapid detection and faster response against malicious actors that target critical infrastructure. The idea that we as HHS, if an event were to happen in our sector and we reach out to some clinic or hospital,
Hmm.
demanding this information, demanding that information, not that we're trying to work in partnership to kind of understand what's going on, but if we've already set these behaviors of partnerships and collaboration, it won't
Hmm.
feel as though we're just trying to overtake what it is you're trying to do as you work to
Absolutely.
recover from whatever's happening, right?
Absolutely.
So that partnership can help develop effective policies and regulations, perhaps, that the community that we're actually trying to serve can help create, that benefit all stakeholders and the public writ
Absolutely.
large. And finally, it provides opportunities to continue innovations to advance in ways of strengthening our strategies as it regards cybersecurity practices.
Absolutely. And I think that we appreciate that partnership very much. So, yeah, I think at this point we get Taylor, and I'll tell you what, Mr. Yarborough, any final comments you want to provide or share with us before we go to Q&A?
Um, as I mentioned before, best practices to protect data is to adapt key behaviors in the use of digital equipment. A lot of that is achieved by user awareness training, and just basic cyber hygiene practices. It's a common term. It's something that I say in almost every engagement because to me it's that meaningful and that impactful. Simple stuff: password protections, multi-factor authentication, encrypting data at rest and in transit, and just making sure that your constituency is aware of the malicious threats that can impact them, like phishing, ransomware, and of course knowing where to go, to report these attacks and get help.
Absolutely. I always tell folks you can have too much security or too less of it, right? So it has to be a common balance there. So Taylor, if we want to go to Q&A, if there's any questions that we have, we can go ahead and to that session now.
Absolutely. Well, thanks, guys. Appreciate you being on. Lamont, too. Great session so far. We have one question from James Schuler. He's looking forward to a world where we don't have to remember a password. He says, I keep hearing that the day might come. Do you see a passwordless future?
I do. I do. And actually, I think it's a must, right? There are other technologies that are coming into play that I think passwords will one day be placed into obsolescence. And I think that's a good thing.
Awesome. James, you can look forward to it. Mr. Randy said, I'm also a huge advocate for security awareness training, but I'm concerned so many in healthcare don't really understand HIPAA, what it includes, and why it's important. How do we change that together?
I think it requires constant communication and reinforcement, right? The educational aspects, I think, is most critical because a lot of folks don't, they hear the term HIPAA, but they don't really know it and its implications and its applications, right, to their everyday, things that they do, at work. So I think when it regards specifically for the healthcare sector, as it regards user awareness training, perhaps as an adjunct, you should attach some HIPAA education, right? Because they are, although they are nuanced and somewhat different, they are tangential to each other as it applies the type of work that is performed within the healthcare space. So I would perhaps start there. You have to kind of keep echoing what the implications of HIPAA can mean to the organization and to the data underneath it.
Yeah. The last question on here. So guys, throw some more questions up if you have them. But from Chris Polito, on the subject of hygiene, how does HHS plan to implement SSO for their online portals, or do they plan to implement SSO, such as CMBHS? And he says this would help with disabling accounts automatically when a user leaves the organization and would eliminate the potential that this separate account is not missed in the termination process.
Yeah, well, I think there's an asterisk there on the deployment of single sign-on for those who may not be familiar with the acronym. I think you have to discern it on a system by system basis on the level of access that the individual who would have single sign-on authorities, if you will, and how they interact with those systems. It may be different from someone who's internal to the organization versus someone who's not. I mean, there's a whole lot of things that you need to reconcile from just from an access perspective to, I say that to say you cannot absolutely instantiate one methodology by which, who accesses it. From an SSO perspective, I tend to think, and I often have this dialogue with respect to zero trust and all that it means from identity management, et cetera. What is its impact on things that might otherwise be SSO enabled? So there's a whole lot of things that need to be discussed. It won't be, I don't think, one size fits all, right? It'll be predicated on the individuals who would have that SSO access, and it would be informed by a number of, factors. So I know that's a long way to say I can't answer your question, but it's kind of more complex than just yes or no SSO.
Sure. Okay, we got a few more coming in. So with business email compromises and ransomware attacks increasing year over year, what are the biggest challenges that HHS faces in protecting against attacks, and what steps are you taking to address those advantages? That one's from Belinda.
Sure. So again, I think I mentioned earlier on that there are a number of things from a risk management framework perspective that all federal systems must abide, depending on depending on how they're measured from a confidentiality, integrity, and availability perspective. That will result in a number of technical, logical, managerial, administrative controls for that system. And it's informed again by how sensitive the data that resides on that system, how complex the system is, from a mission set perspective, how available that system is supposed to be, et cetera. But through all of that comes, and it's pretty much laid out, perhaps hundreds of controls that have to be accounted for before that system is allowed or authorized to operate, a term that we use in the federal government. So that reconciliation occurs within the federal system, even if it's public facing, right? And that will continue to go on. Of course, the ability to perform mission, you have to be able to reconcile. You can't have so many controls that you can't use the technology. And that's where that local CISO or CIO gets involved and makes a risk determination on accepting perhaps some level of risk that perhaps another system within our agency would not be willing to accept. But from where I sit, I ensure that, from a baseline perspective, that these notional security goals and measures are being met, right? And of course, weigh in on if I think there's some opportunities to introduce some further restrictions when necessary if we see a pattern of compromises, et cetera.
Awesome. From Dedrick, excluding security awareness in 2023, what are the top 2 IT security challenges for the healthcare industry? And based on that, what critical action are trending in the industry to combat those challenges?
On any given day, I may give you a different answer. But of course, what with the prevalence of COVID some 3+ years ago, not that we weren't a target of opportunity for bad actors before then, but we became a target of opportunity on steroids after the prevalence of COVID. They thought we were weak, we were in a state of panic, and as we began to send employees home to work from home, we just expanded the attack surface, right? So not only do bad actors will, attack us on our federal systems, but they're going to try to attack home networks as well because they know that's where we are, right? So I would say that, and I would say ransomware, right? Ransomware is probably, most prevalent not only within our sector, but pretty much everywhere else. And of course, ransomware is a form of malware, but bad actors have really spent a lot of quality time making those things really calamitous to a great number of industries, right?
Mhm. Absolutely. Last question from Mike is, what are your thoughts on the use of biometrics in regards to logical access?
In my experience, I find that a lot of folks are uncomfortable with giving their biometric data, the biological data that would be used for, biometric technology, right? So not saying that there's not wherewithal within a number of agencies to leverage biometrics, but the folks who would actually have to use them take some umbrage in, giving their iris, having to deal with fingerprinting and iris scanning, et cetera. And that's not to say that we won't achieve a paradigm where perhaps it will be, more prevalent or perhaps more ubiquitous one day. I just don't see a lot of activity in that space, with the exception of perhaps some of the more classified, systems and activities.
Yeah. Last minute question from Anthony. um, he has healthcare clients asking about third-party risk assessments. What are the top 3 questions to ask in a risk assessment? Is this just a questionnaire that gets provided? Should the client set the minimum standards in the questionnaire? If a third party does not meet the minimum, should that end the deal with a third party? Pretty loaded question, but
Yeah, it is. And there's probably 5 million ways I can answer it. What I will is say this. You should be clear to set an expectation that any third party you may wish to bring into your fold meets the same minimum security baseline that you require for your own systems.
Absolutely.
If they cannot do that, then they should not be in your space.
Absolutely.
is an MSP a covered entity?
I don't want to say yes or no. I think it just depends upon the contract language, right?
Right. Well said. Well said, Mr. Yarborough. All right.
All right, that's it for questions. So I'll toss it back to you, Anthony.
Okay. Cybersecurity Month, October. Mr. Yarborough, thanks for coming out. We plan to follow up with our appreciation from Center and our customers on this public-private partnership is huge, right? And it didn't exist before, so we appreciate the time that you spent educating us on cybersecurity.
Oh, no worries. Happy to be here. And I'm glad it's Friday. And I'm going to go get that coffee. I was singing it right now.
What?
You're muted, Anthony.
What is Friday like for you at HHS? Is it pretty up downswing or on the upswing, or what do you?
I think psychologically, I think most people go into Friday thinking I'm just going to get to whatever priorities I need to carry me through to Monday, and hopefully it'll be an uneventful day. You can aspire for that, but a lot of times it just doesn't turn out that way, right?
Often say it comes in waves.
Absolutely,
It comes in waves.
absolutely.
All right, we'll wrap it up here. Mr. Yarborough, again, thanks again. I mean, your time's valuable. You got a lot of responsibilities. We appreciate your time here at Center and on behalf of our customers as well.